Hi, I'm Dr. Foo Chee Hoe, Consultant Pediatrician, and once again I would like to welcome you to our part 2 of our discussion and sharing about managing fever in children. Okay, next I would like to talk about the use of medication. Of course, the most common known medication would be paracetamol. So paracetamol is the generic name. In the market, you will hear brand names such as Panadol, Tylenol in US, and also known as Euphamol, Excel paracetamol, Avadol, and so many more. Now, all these are actually the same thing. Yeah, sometimes it may come in orange flavor, it can come with a strawberry flavor, but ultimately it works the same. Yeah, some children will prefer orange flavor, and quite rarely some will prefer the strawberry flavor. I do not believe that this brand will work better than that brand. I think what is more important that it must be a fresh syrup, that one that is not expired and one that is stored properly, and also given in the right amount of dosage, not too much and not too little, for it to work very well. But is paracetamol or any other fever medicine the be-all end-all of fever management? No, definitely not. Yeah? The purpose of giving this syrup medication is just to make the child more comfortable. It is not to cure the child from having fever. If the child is just going to have fever due to immunization, whether you give or not, the fever should resolve in 1 or 2 days. If the child is going to if the child is having a bad fever because of dengue fever, definitely using paracetamol is not to cure the patient. In fact, we frown upon using too much or at all using paracetamol when you treat dengue fever, because the fever in dengue infection, it will settle by day 4, day 5 or a bit more longer naturally. So sometimes it is definitely not worth it. It will end up with more trouble if you give too much medication, give syrup medication and then give syrup via the anus suppositories. You end up over-medicating the child and end up with more result. Whereas actually, if you do not give so much medicine or do not give at all, the child will naturally recover. So again, it is very important to treat and approach fever in children with a holistic picture, taking everything into consideration and look at the whole bigger picture, and not just be so obsessed with the number. Oh, it's 39 again. Oh, it's 40. What should I do? It is very important to correlate with the child's status. Is the child very alert, very active, or is the child very weak? So you have a large part of treating fever is to determine the cause of the fever. If it's an infection, where is the infection? Is it a ear infection? Is it a throat infection? Should I check for dengue infection? Should I check for influenza doing a nose swab test? And also, of course, in the time of COVID, could it be due to the coronavirus? So if you just give paracetamol to treat the fever and do not find out the cause or get an idea of what can cause the fever, you are merely sweeping it under the carpet. Alright? So the use of paracetamol is just to make the child more comfortable, so that the child can sleep better, less cranky, will cooperate more, will be able to drink and eat more, and rest better. Alright? Then the next issue is, should every child who has fever to be given antibiotics? Definitely the answer is no. Yeah, definitely antibiotics is not a must for all fever. Back to my main statement just now, we have to find out the cause of the fever. If the doctor is very confident that the cause of the fever is virus, then there is no use for antibiotics. Antibiotics such as like Xenon, Augmentin, all those, they are designed and created to work against bacteria. Bacteria and virus are very, very different. They are live in different kind of universe. Bacteria is much larger than virus. The way they cause illness to the human body is very different. And antibiotics attack the weaknesses of a bacteria. They do not attack the weakness of a virus. So antibiotics should not be given without a proper reason. I would say if the child is diagnosed to have a lung infection or a tonsil infection or a urine infection or ear infection, antibiotics has an important role to play. But if the child is diagnosed to have dengue fever, hand, foot, mouth disease, chicken pox, then antibiotics is not indicated unless the doctor is really worried about a secondary bacterial infection. Can teething cause fever? There's no strong scientific evidence to suggest that teething can cause fever. However, between 6 months to 2 years old, it is very common for a child to have their very first experience with a significant viral fever, a viral infection like a Roseola infantum, where they will have 3 to 5 days of intermittent high fever, otherwise quite well, and then they will develop some rashes later on. During this period as well, there's a lot of teething that has happened. The child would have their first few teeth emerging in their gums, and they will feel discomfort. So sometimes putting all these things together, it is not surprising that teething and fever are lumped together. Can fever cause brain damage? The basic answer is definitely no. High fever means that your body is working hard to fight the infection. Of course, there are a lot of infections with high fever that can result in brain damage. That means that brain inflammation has taken place, and this is due to a progressive infection, either by a virus like influenza virus or chickenpox virus, that has progressed into the brain cells and caused severe inflammation and damage. It can also be caused by a bacterial infection which goes into your brain cells and cause a severe infection. Of course, in this kind of severe infection, the child would react by having a high fever. So the fever is a sign and a symptom of the illness. It is not fever that caused the damage. It is because of the insult injury caused by the virus itself or the bacteria itself that caused the damage to the brain cells. Your fever is like a policeman in a police car with a loud siren or an ambulance siren. It is giving warning, people, something is wrong, do something, something is wrong, do something, we are fighting. It is not the ambulance or the police car with the loud siren on that is causing injury to yourself. It is the thief, it is the gangster, the mob gangster that is causing the damage, and the bacteria and the virus is the gangster that you need to catch, you need to treat. Do not blame the siren, we blame the thief. Of course, there's also something called febrile fit of seizure. The child develops a seizure. It looks very scary. It's like an epileptic fit where your child immediately in the first day fever, the child will suddenly stiffen, lose consciousness, not answering you, the eyes looked upward, clenching of teeth, drooling, frothing at the mouth, and then you have jerking like this, like that, and also it can last usually less than 5 minutes. It is very, very frightening. Unfortunately, there are 4 to 5% of population of children between the age of 6 months to 6 years. About 5% of children will develop febrile fit in the height of the fever. But this is very different from brain damage. This is not a result of a serious infection. A simple viral fever can cause this, and also after vaccination by such as MMR vaccine can also cause this. It's just that the brain cells in the child is a bit oversensitive due to a sudden rise in the body temperature, so much so that suddenly there's a short circuit that happens where you send down all the abnormal signals to trigger abnormal uncontrolled movement of the body, which only lasts for a few minutes. So this is what we call a febrile fit. Of course, there are some cases where, very unfortunately, the febrile fit unattended to can last for more than 5 minutes and lasting to 20 minutes, and this may also cause lack of oxygen intake, which may indirectly cause brain damage. So again, in a child with febrile fit, you have to be extra careful to manage the fever a bit more aggressively. But again, the bottom line of what I'm trying to say is that fever itself do not cause brain damage. Fever itself do not cause life-threatening disease, but it is merely a warning sign. It is a defense mechanism. It is a reaction from the human body to an insult or an injury caused by a foreign object, a foreign agent like a virus or a bacteria. Well, that's all. Thank you for your attention, for your interest in this sharing. I hope that my little sharing today in part 1 and part 2 is useful for your future handling, dealing with fever in children. Thank you so much.